COVID-19 cases in domestic condition and also with the imported cases to further curb the spread. For the Xinfadi markets and surrounding areas, we will apply the most strict epidemiological investigation and do the sourcing work so that we can be very proactive in curbing the spread from the very source. For the key groups of people, we will continue with the full coverage of the epidemiological tests so that we can discover the confirmed cases and asymptomatic cases as soon as possible. We will also strengthen the prevention and control measures on the residential communities. For 4 types of people, we will have a closed management, and also for the hospitals, we will strengthen the management to fight against the nosocomial spread of the COVID-19. Today, we have invited spokespersons from relevant authorities to talk about this epidemic situation, and I'd like to present the speakers for today. They are Mr. Xiao Sa from the Beijing COVID-19 Prevention and Control Leading Group, Gao Xiaojun from the Beijing Health Commission, Li Junjie from the Haidian District. First of all, I'd like to give the floor to Mr. Gao Xiaojun from the Beijing Health Commission to talk about the nucleic acid test results of people in Xinfadi market and other relevant places. Friends of the media, good morning. Now I'd like to talk about the related results of the nucleic acid test for people in Xinfadi market and other areas. On the 14th of June, according to the principle of testing all the people that should be tested, the institutions have tested 76,499 cases, among which 59 positive cases. Ditan Hospital have 27 in-hospitalized samples. There are 11 samples to be further checked in order to better control the epidemic results tests for the people in the Xinfadi wholesale market. We have collaborated with other districts and the Jishuitan, Anzhen, Chaoyang hospitals to use their laboratories and also work with third parties to help the government of Fengtai district to carry out the collections of information and data and also the samples for the tests. As of yesterday, we have set 193 test points in Fengtai. We have completed the samplings 8,950 for all the people working in the Xinfadi market. And we have also run 6,075 samples of people related. As of the 14th of June, by 20 p.m., for the residents around Xinfadi market, we have completed 40,000 samples. All the results are negative. For people that have visited in 2 weeks' time the Xinfadi market, we have taken more than 20,000 samples. We have completed tests on 10,000 and more people. All of them are tested negative. Once again, we'd like to warn the people from Beijing. For those who have visited Xinfadi wholesale market for agro products, or who have a close contact with a salesperson inside the market since the 30th of May, please inform that to the local authorities and join the nucleic acid test and stay at home for the quarantine. If you have symptoms like the cough and also the burning throat or the running nose, please go to the closest fever clinic or the capable institutions. That is all for my briefing. Thank you, Mr. Gao Xiaojun from the Beijing Health Commission. And now I'd like to give the floor to Mr. Li Junjie, the Permanent Deputy DG of the District of Haidian, to talk about the prevention and control of their district. Friends of the media, good morning. Recently, Yuquandong trading market have discovered several cases of patients related with Xinfadi market. Under the leadership of the district and municipal COVID-19 response work group, we have taken seriously the health of the people and their safety. We have assumed our responsibility and carried out the epidemiological investigation, the tracing, and the control of the source of this epidemic. For 24 o'clock a day, we have the people on duty. First of all, we have closed down temporarily the market. We have also the full coverage for the people that should be tested for the nucleic acid test. We have shut down the market and also completed the disinfection of the market for all the people working inside this market, and for the people living in the surrounding areas, we have also carried out the epidemiological test. For those people tested positive, we will run a epidemiological investigation on them and also carry out the nucleic acid test for the people that have a close contact with the confirmed cases. For the other people detected, we will continue with the tests and we will ask them to wear a smart thermometer that can trace their temperature evolution all the day. We will restore the level 2 emergency mechanism for the risk level, and we will stop the spreading of the virus towards other districts. From 0 o'clock, the 15th of June, for the relevant residential communities, we start the close-down measures, and we also send the party members to the communities for the direction of the work. We have also started the disinfection of the residential communities, and also we have guaranteed the supply of life necessities. For the primary schools and middle schools, for those students of the low grade, we will stop the offline classes. They will continue with the online training program. And we will also ask the students in the graduation classes to wear the thermometer that can trace their temperatures. Moving forward, we will continue to follow the guidance of the municipal response mechanism and continue to work very hard to be very strict for every step of the work. We will include every case that should be tested and stay vigilant until the end of this fight against the COVID-19. Thank you, Mr. Li Junjie, for your briefing. And now I'd like to give the floor to Mr. Xiao Sa, the Chief Director for the inspection team, to talk about the cases of leaders failing their duties. Good morning, friends of the media. Since the 11th, we have discovered several rounds of cases. Until now, we have reported 62 newly added confirmed cases. In the big data tracing, we have found all the people confirmed have the trajectory related with the Xinfadi market. We have established a discipline check group for the people that have failing their duties. During this work, we have clarified the information. Zhang Yueling, Wang Hua, and other persons, they have failed their duties in containing the epidemic and also failing their duties in applying the disinfection measures. For Zhou Yuqing, he will be removed from his post, and according to the decisions of the Fengtai district, Wang Hua will be removed from its post. And we will have interviews with the persons in charge of the Xinfadi market. Zhang Yueling will be removed from its post. For the other persons in charge, they will also be punished and be followed. Thank you for Mr. Xiaosha for your briefing. And now I'd like to give the floor to the journalists. Before asking the question, please first identify yourself.
谢谢主持人，北京日报记者提问。有一个问题想请教李
Thank
局
you.
长。
I'm from
刚才
Beijing
你也提到
Daily.
了全东交易市场的情况。
I have a question for Mr. Li Junjie from
全东交易市场
Haidian
的下一
District.
个
Just now you have talked about the Yuquandong market. What is the next level of prevention and control, and what will be your focus? Thank you for your question. Since 8 o'clock this morning, we have started the nucleic acid test for the residents in 10 surrounding communities. According to the test results, we will further evaluate our next step of working plans. We will communicate with the people, and for those people that have visited Xinfadi market or the Yuquandong market over the past 2 weeks, we will give further tests on them. Thank you. That is all for the Q&A session. The press conference is organized by the Information Office of the Beijing Municipality. You can watch our press conference through several terminals and applications and platforms. For example, the Xinhua News Agency online platform, Xinhua Beijing Channel, CCTV News, and ChinaNet. We have the online live stream program, and you can also follow up the program with the radio programs and also the TV programs. I'd like to say thank you for all of them, all of you, and all of the spokesperson today. That is end for our morning session of the press conference.